So for Chapter 13 for therapy, remember Mr. Ray and I divided up the material for both disorders and for therapy. So just a couple things to remember that aren't even necessarily listed on this sheet, but they're listed instead in the packet that I gave you. So keeping in mind the David Rosenhan study, remember the Rosenhan study was the one where they were admitted to mental health facilities, and complained of hearing voices. Remember that Rosenhan study really introduces us to the power of labels and how dangerous labels can be. We've updated to the DSM-5. Remember that with the DSM, its job is simply to provide a tool in order to classify and organize disorders. It does not offer an explanation of where the disorders come from or how to treat the disorders, but instead it gives like prevalence rates and the different diagnostic criteria and things like that. Keep in mind that in terms of early treatment approaches, things have changed quite a bit. Remember, it started out with imprisonment and techniques that weren't all that safe for patients or anything like that. Philip Pinnell was the first physician to remove the chains from seriously mentally ill patients. And then remember, in the United States, Dorothea Dix in the 1840s was also a huge part of freeing the mentally ill from mistreatment in jails and places like that. And then she was pretty important in helping to establish state-funded mental hospitals. Remember, the process of deinstitutionalization was releasing patients from places that they probably shouldn't have been, and obviously trying to create treatment centers or community mental health facilities or outpatient treatments or things like that. Okay, so that's kind of the overview. For my therapies, a couple things. First of all, the term psychotherapy is basically every approach that you can take to treating disorders. Okay, so psychological techniques, everything that's not medical. Okay, remember, medical will be biomedical, and we'll talk about that in the second half of this video. A clinical psychologist is one who has their training in abnormal types of psychology, and they work to diagnose and treat disorders using a variety of different therapies, but they cannot prescribe medication. A psychiatrist has a medical degree, and they can prescribe medication. So our first approach is the psychoanalytic approach. Remember, we associate the psychoanalytic approach with Sigmund Freud. This approach in general is really looking at the unconscious being the driver of disordered behavior. So their goal is to bring repressed motives, desires, impulses, conflicts, things like that into your consciousness so that you can deal with them. So they're going to use a variety of different techniques to do that. They're going to use free association, dream analysis, they could use hypnosis, things like that. So in free association, remember that that's kind of where you're just talking. We kind of associate this one with like laying on a couch outside of the line of sight of the therapist. A couple terms that come into play here. Resistance. Resistance is when a patient might unconsciously try to censor their thoughts or feelings or sabotage their therapy. So this is going to be something that therapists are looking for, because they're going to say that resistance shows up when your unconscious is trying to keep you from accessing these thoughts that are driving things. So you might miss appointments, or you might frequently lose your train of thought or something like that, and therapists would interpret that as resistance. Transference is another thing that we might see, and that's when a patient treats the psychoanalyst like someone from their past, like a parent or something like that. So if all of a sudden you get really angry at your psychoanalyst, or you develop feelings for your psychoanalyst or things like that, they would say that that is kind of like a window into your unconscious, into something that's driving your current behavior. When it comes to dream analysis, remember, we're looking at manifest and latent content. Manifest is like, man, I had this dream last night, there was a bear chasing me through the woods. So it's what you remember and what you tell to people. The latent content would be the hidden meaning. So remember, that's what your therapist would, or your psychoanalyst would talk you through and explain what your dream symbolizes, okay? Different tests that they use in this method as well are projective tests, and remember the TAT and the ink blot. Remember the TAT is where you're given a series of pictures and you have to make up a story about those pictures. Moving on from there, our next main area of therapy is humanistic therapy. Another thing to know about both of these types of therapies is that they're insight therapies. They're trying to help you gain insight into something that's going on with you. They're just doing it very differently. So our humanistic therapies, just keep in mind what that approach is doing. Remember, they focus on the good in people. They basically say that people are innately good, and if you have your needs met and you understand who you are and all of that, that you'll become kind of the best, healthiest version of yourself. So Carl Rogers is the main person that we associate with this type of therapy. Remember, he created what's called client-centered therapy. So anytime the word client is used, that's going to be a humanistic therapy. It's a non-directive form of therapy, so remember that they're going to use the method of active listening, so really making sure that they're listening to what you're saying, helping to clarify your thoughts so that they're actually understanding what you're saying, and really the idea is to help you sort of figure out what's going on with you, okay? The terms that we associate with this, remember that in order for Rogers' therapy to work, he says that you need three things: genuineness, acceptance, which is known as unconditional positive regard, and empathy. So with those three conditions, he would say that we're probably in the best shape to be able to figure out what's going on with us and then reach that highest level of self-acceptance and understanding. Gestalt therapy, again, I don't think that this is one that you're necessarily going to be tested on, but it's a form of therapy where they're looking at the wholeness of the person and trying to kind of remember how Gestalt talks about the whole is greater than the sum of its parts. That's what you're focusing on with Gestalt, is not just breaking down the individual pieces, but really looking at the whole person. And again, if you got that, there might be a general question on that, but overall, there really shouldn't be anything. We could talk about group and family therapies as well. When we talk about humanistic therapy, remember that with group and family therapies, group therapies are like self-help groups like Alcoholics Anonymous or things like that, or support groups like if you've lost a loved one. And then family therapy is obviously bringing your family together. So the idea is that people don't exist in a vacuum, but instead that other people around us can help us as well. So if it's Alcoholics Anonymous, knowing that there are other people who are dealing with similar things as what you might be dealing with. All right. My last therapy then is biomedical therapies. Remember that this is going to be anything that's dealing with medication or any sort of treatment. So treatment in terms of like we're going to shock you or something like that, but like a medical type of treatment like that. Drug therapies are known as psychopharmacology, and I've listed a variety of those therapies here as well. So antipsychotic drugs, those are used to treat schizophrenia or other psychotic disorders, like psychotic breaks and things like that. They are drugs that block dopamine receptors. Some of the names are listed there. And then don't forget about tardive dyskinesia. So long-term use of things like Thorazine and Haldol and stuff like that could result in that condition, which really just shows up as facial tics. Clozaril is the newer medication that is not necessarily supposed to be associated with those side effects. Okay. Anti-anxiety drugs, I've listed a couple there, but their goal is to reduce anxiety and fears. The problem is that they're highly addictive, so you have to be really careful with anti-anxiety drugs. Antidepressant drugs, again, a couple are listed there. These drugs typically block the reuptake of serotonin. There are other ways for drugs to work as well, but the SSRIs are really the most common ones. Other antidepressants would work to block the reuptake of serotonin and norepinephrine, but they can have more drastic side effects. Lithium is associated with treating bipolar disorder, so it's supposed to reduce the highs and lows that someone might experience. It has to be carefully monitored because there might be some side effects and things like that. There are also anticonvulsants. Anticonvulsants, Depakote, is probably the most well-known one. Again, I don't think that you'll be tested on that one. Let's see, what else? Those are kind of the main drugs that we can use to treat. But remember, when we're talking about biomedical therapies, outside of drugs, so psychopharmacology, there are other things that fall under biomedical, and those would be electroconvulsive therapy, known as ECT. Remember that that's used only to treat severe depression when everything else has been tried, and it's where they pass an electrical current through the brain, and the side effect would be memory loss. It is said to be effective, but again, it's used infrequently. And then psychosurgery, which really isn't done anymore, but it would be destruction of brain tissue, and a lobotomy, again, not really done anymore, but it's a rare procedure that they use to calm violent or uncontrollable patients, and that's where we destroy part of the prefrontal lobes. Okay, so really that's kind of the overall on my therapies. I've listed here, remember that these are on your summary notes, but some pros and cons to institutionalization versus deinstitutionalization. So just kind of keeping that in mind. And then the history of treatment that I mentioned at the beginning of the video, that's also on your summary notes, and I think it's relatively easy to understand.